Have you ever wondered what fibroids are and how they can affect your health? This is a question many of us may have pondered, and the answer might surprise you. Fibroids are, in fact, non-cancerous growths that develop in or around the uterus. They're not as intimidating as they sound. These growths, which can vary in size from tiny, barely visible lumps to bulky masses that can distort and enlarge the uterus, are often found during routine checkups. Interestingly, they are quite common, especially among women of reproductive age. It's estimated that 3 out of 4 women will have fibroids at some point in their lives, but many will never know because fibroids often don't cause symptoms. However, for those who do experience symptoms, fibroids can present significant challenges. Stick around as we delve deeper into the world of fibroids, their causes, symptoms, and treatments. This is just the tip of the iceberg, and there's so much more to uncover. So, what causes these fibroids to develop in the first place? It's a question that many ask, and the answer is multifaceted. Hormones play a significant role, specifically estrogen and progesterone. These hormones stimulate the growth of uterine lining during each menstrual cycle and may promote the growth of fibroids. Genetic changes could also be culprits. Certain fibroids have been found to have unique genetic patterns that are different from those in normal uterine muscle cells. Other growth factors, substances that help the body maintain tissues, could aid fibroid growth too. Extracellular matrix, a material that makes cells stick together, can also contribute. It's richer in fibroids compared to normal uterine cells and can affect fibroid growth. Certain factors can increase a woman's risk of developing fibroids. These include age, family history, ethnic origin, obesity, and even eating habits. Now that we understand the causes, let's move on to discuss the symptoms of fibroids. How do you know if you have fibroids? What signs should you look out for? Well, fibroids can present a variety of symptoms that can disrupt your daily life. One of the most common symptoms is heavy bleeding during your periods, which can sometimes be so severe that it leads to anemia. You might also experience periods that last longer than a week, another red flag, but the signs don't stop there. You may feel a sense of pressure or pain in your pelvic region akin to a constant dull ache. In some cases, this can extend to your back or your legs. Frequent urination, difficulty in emptying your bladder, and constipation are other symptoms that might suggest the presence of fibroids. But here's the tricky part. Some women may not experience any symptoms at all, making fibroids hard to detect without medical examination. Knowing the symptoms is half the battle, but understanding the treatment options is equally important. So, you've identified the symptoms and suspect you may have fibroids. What next? Well, the good news is there are various treatment options available. Mild symptoms can often be managed with over-the-counter pain relievers and medications that control menstrual bleeding. If your symptoms are more severe, there are non-invasive procedures like MRI-guided focused ultrasound surgery, which can destroy fibroid tissue without making an incision. Minimally invasive procedures, such as uterine artery embolization, use a catheter to deliver small particles that block the blood supply to the fibroid, causing it to shrink. Then, there's the traditional surgical procedures like a myomectomy or hysterectomy, which involve removing the fibroids or the entire uterus respectively. In addition to these medical treatments, certain lifestyle changes like maintaining a healthy weight and regular exercise can help manage symptoms. But remember, it's crucial to consult with your healthcare provider to determine the best treatment plan for you. Let's quickly recap what we've learned about fibroids. These are non-cancerous growths that develop in or around the womb, caused by hormonal changes, genetic factors, and lifestyle. Symptoms can vary, but effective treatments are available. Remember, staying informed is your first line of defense. Don't ignore the signs and consult with your healthcare provider if you suspect you may have fibroids.